I have completed undergraduate in psychology and master's in research. Both of my projects involved studying skin picking. So it's a form of BFRB that I personally experience and have a lived experience of. And therefore, I was very keen to study, especially after I realized there really isn't much research out there and there is still a lot that we don't know yet. So my first study looked at the relationship between skin picking and emotion regulation and attachment. And my second study looked more on the experience of skin picking. So how does it affect people, how their daily life looks like, and what are they really needing in terms of support. I also serve nowadays on a committee of BFRB UK and Ireland, which is the first dedicated charity in the UK.
But what are BFRBs?
So BFRB stands for Body Focused Repetitive Behaviors, and these are actions that involve manipulating your body in some way that causes damage to the tissue and usually distress. This can be picking of the skin, pulling of the hair, biting, chewing, any part of the body can be affected, really. The common examples are skin picking, hair pulling, and I think the one that people are most familiar with is nail biting. But there are some other ones, such as, for example, lip and cheek biting, nose picking. So any part of the body and any repetitive action can really be involved.
Nail biting, yeah, that's a really common one, isn't it?
Absolutely. So we know that BFRBs affect around 5% of the general population. It might be an underestimate. It is likely to affect more people, but we don't have the complete figures. But within that, we know that the nail biting seems to be the most common one, especially amongst children.
How does it affect people?
It can affect people in really variety of ways and in a variety of degrees as well. For some people, it will be mainly about physical damage, so experiencing pain, bleeding, infection, kind of bald patches of the hair. But for a lot of people, it will go on to have a psychological impact. So things like anxiety, shame, embarrassment, kind of efforts to camouflage or mask the impact. And I think when it comes to children, also very often not really understanding why am I doing this and what it really is. It really takes time people to learn a little bit about this behavior, to be able to put a name to it. So it's very commonly seen as just a bad habit. That's a phrase that comes up really often. Sadly, even among the healthcare professional, it's really seen often as something not serious enough, something that you can maybe deal with by putting some creams on or wearing gloves. While in fact, we know there's much more to it than that.
There's a sort of compulsive aspect to it. Is that right?
Absolutely. So formally, it's classified under the obsessive compulsive and related disorder umbrella. So there is definitely this compulsive element. So it's very much not about the willpower. This is just a compulsion that is very difficult to essentially stop.
So how do you know if something is a BFRB?
I think a lot of us will be familiar with different of those behaviors. We often call them self-grooming behaviors, and we can even see them in animal kingdom. It's very common for mice to, bite their fur, or parrots to pluck their feather, things like that. But even for us, different kind of cosmetic routines that we have that might involve squeezing a spot or pulling a hair that is just sticking out in some kind of wrong way that bothers us. I think a lot of us will be familiar with that. But what happens with BFRBs is that then those behaviors get kind of hooked up in this unhelpful loop, when they become very frequent and very difficult to stop, even if we really want to. So that's the kind of main difference we're looking at 4A. So whether there is an impairment, so if the person is affected by the behavior, if they feel bothered by it, if they're experiencing some kind of injury or damage from it, so there might be bleedings, infections, scarring, bald spots, increased time, so kind of more and more time, or more time comparison to how it started anyway, spent on the behavior throughout the day, and the issue with stopping as well.
So mine is pulling my hair here, and I will do it sometimes kind of subconsciously, especially if I'm very stressed. I sometimes don't even notice I'm doing it until I see hair on the keyboard or like there, and then I'm like, okay, and then once I'm aware that I'm doing it, I find it even harder to stop.
Yeah.
And then I'm like, oh, now I just want to constantly do that.
Yes, this is such a common experience, and we know that for around half of people, indeed, it happens completely unconsciously, and you usually only realize, as you say, during.
Yeah.
And indeed, that doesn't necessarily make it easier to stop, because very often realizing that you're doing it comes with shame, comes with thinking I should be able to stop, but it feels so good, it's giving me the relief that I need in the moment. But a lot of this obviously happens unconsciously, so we don't have those conscious thoughts. All of this happens inside of us without realizing, but it results in just being really hard to stop.
Yeah. Are there ways, like what kind of ways are there to manage it?
And notice, name, and navigate. So first of all, when it comes to noticing, having an awareness of what it is. So for a lot of parents, this will be about educating themselves to learn a little bit more about BFRBs and what function do they serve. It's really important to know that it's not a bad or not a behavior. It's not the child's fault. It's a compulsive condition that is really difficult to stop. So first of all, it's kind of noticing that and having that awareness. It's really important to have conversation about it, but in non-judgmental, non-shameful way. So you could use phrases like, I can see that your hands are looking for something to do, let's help them to keep busy. Or I can see that your skin is bothering you, let's help to keep you comfortable. So phrases like that don't bring any kind of intentional shame, because shame, we know, it's a huge factor for those conditions, whether for children or for adults, even more so. In terms of strategies that can help, what we can offer in that situation is essentially a competing action. So something else that we can do with the hands. For children, this can be about clenching their fists or squeezing a stress ball, doing something with a Play-Doh or any other sensory tool or fidget tool that you can think of. If it happens during a school, it can be about sitting on your hands, putting your hands under your legs and just sitting on them for 60 seconds or longer. It's just about allowing this kind of urge to ease off a little bit and offer hands a competing action. When it comes to awareness around the behavior, trying to notice, are there any situations when it happens more? It can be about the time of the day. For a lot of the people going to bed, it's an period where the behavior increases. Also at times of stress or at times of being idle and concentrating. So it can be sitting on a laptop or sitting on the bus. So bringing a little bit awareness to what situations this happen and for me or my child most, and how I can maybe adjust the environment to make it less likely. So for instance, for those of us who would go to the mirror and consciously do something with our skin, it can be about covering the mirror or even about dimming the lights. It can be also about introducing a lot of self-care in terms of skin. It can be about moisturizing the skin, maybe gentle touch or a massage. It's really different things work for different people. It's almost like creating this tool belt of different things that work for you.
Okay. Oh, I love that. That's really, really helpful. I think that's really useful in so many situations as well, that like, if you know that you have a whole range of different tools, you can just go to those things to help you to regulate. My dad has some hair kind of brushing behaviors. And then I have pulling. And then my kids have biting and chewing. So my daughter chews everything.
Yes.
Like she'll chew off all of her sleeves, and my son bites like that as well. So is there genetics? Do we know anything about the genetics of it?
Yes.
Or they learned it from me, or where does it come from?
Absolutely. Just to say on a personal level, I can totally relate to this because I'm a skin picker. And although I didn't see any of this in my parents, both of my kids have those tendencies as well. With my one son picking a lot in his kind of upper back, that part of his body is really covered in scabs constantly, while my younger son is a chewer. So he will chew exactly as you say on his sleeves and everything that he can come in contact with, really. when it comes to what science says about it, we know that it's unlikely that there is one cause, one specific factor that results in BFRBs. However, in research, we did notice it does tend to run in families. So there is a likely genetic component. At the same time, kind of learning from what kids see in their parents can also play absolutely a role. So if two people in a family have the behavior, it is very likely a combination of the genetic predisposition. So not so much a gene that is causing it, but more of a genetic vulnerability, just the fact that you're more likely to respond to stress in that specific way. Okay. So it's a combination of that genetic vulnerability with the learning from the environment.
So I like the idea then, you can, if you have some of these tools, you can use them for yourself, and that can help your kids learn ways of managing that as well, so that then as they're growing up, they have those tools with them.
Absolutely. I think having a lived experience of the condition you notice in your child yourself can be actually a strength, because you can learn all the strategies which you can then pass on to them, and you can understand also how it feels. I think for a lot of parents who don't experience this, the first instinct can be just to ask the child to stop, and it comes from the place of care. You want what's the best for your child. But if you have never experienced it yourself, it might be hard to understand why is it so hard to stop, or why even it would be not the right thing to say. So having that understanding can be actually super helpful in terms of that kind of empathy, but also in terms of learning strategies.
Yes, I completely agree. Yeah, because the and that shame element, where it might be something that you spent your life hiding, now you know that you can explain to your children this is what's going on, and you don't have to feel shame over it, and then that shame won't get you into the spiral of doing it and hiding it and feeling shame and then doing it more.
Absolutely, because it can be such a lonely place when you're doing something that you know is causing you harm, but you don't really understand why, and why is it so hard to stop. So I think the response from parent, carer, teacher, or whoever else happens to respond to the child, the way they respond really, really matters and can make all the difference. We know that shames can start really early, so we can notice like child trying to hide the plucked hair so that parents don't notice. That already indicates that even in that young age, children might already start developing that awareness that something that I'm doing is not right, which essentially leads to shame, which helps to, or not helps, but makes this cycle to kind of go on rather than help to break it.
Are they a sign of an underlying mental health problem? I think that's something parents will worry a lot about.
Absolutely. So the BFRBs in themselves are not necessarily a sign of any underlying mental health problems. It doesn't mean that your child is experiencing anxiety disorder, OCD, or trauma. However, at the same time, very often they are triggered by big feelings, times of changes or stress, or even actually very often boredom. So essentially, the best way to approach them is a sign that your child needs more support and strategy to help them manage whatever is happening for them. Okay. So BFRBs are classed on the kind of, like I said, obsessive compulsive and related disorder spectrum. Mm-hmm. So if you notice that this is causing kind of increased amount of distress, then there are kind of strategies and ways to help. However, at the same time, it's really important to understand that essentially it's not a character flaw or a sign of weakness. It's just the coping strategies that the person finds really, really soothing.
Okay, that's really helpful. So kind of related to that, what do you want parents to really know and understand about BFRBs?
That it's neither your fault or your child's fault that this is happening. It's a way of coping that some of us come to develop, and because of kind of the brain pathways and the way that brain works, it learns that this is helping, so we just kind of keep doing that. So it's a behavior that's really hard to control once it gets hooked up in that loop. But it's not a bad behavior. It doesn't mean that the child is not coping or doing something wrong. Second of all, that the BFRBs are really common, and they're real conditions. I know that they don't have great awareness, so a lot of us would have not, come to hear about it. Even like I've mentioned, the healthcare profession, sadly, they're very often either not known or misunderstood as simple habits that are just easy to break, like any other habit, which absolutely is not the case. And finally, that recovery or getting better, it's not kind of oral nothing really. It's about compassionate understanding and learning strategies to help. If we focus on absolutely stopping the behavior, it can create a lot of pressure. But if we think of recovery as just trying to learn strategies, learn our triggers, help to figure out what works, and just minimizing the role of the behavior in life, it makes a much more kind of compassionate path. I hope that that's the way to go. Also, based on my personal experience, I know that, for instance, my mom, by telling me to stop, had all the best intentions in the world, but it definitely would make me even more kind of ashamed and frustrated with myself that I should be able to stop, but I couldn't. But if she had learned about the behavior a little bit more, used maybe a little bit of different language, and really helped me to develop other strategies, I think my recovery would look different.
Yeah, I think that's so important. That's when I saw you talking about it, I thought I really want to share this with people, because a lot of us grew up with that shame around things. I remember friends who were nail biters, who used to constantly have to put all these nail polishes on and stuff, and it was like an endless frustration for them, because they just couldn't stop. And now you realize that actually that's probably what was going on, that they had this behavior that was compulsive, and it wasn't as simple as like, it's dirty, don't bite your nails.
Absolutely. And hopefully, as now the awareness is growing, I hope that, people like teachers and doctors and other who come in contact with us will be a bit more clued up and will be able to respond in better ways.
Yes, that would be great. I think, the more awareness to it, the better. I like your kind of framing of it in general, and that it's not like something that you kind of have to cure and stop. It's about, like a lot of behaviors, just having empathy and not shame over it, and finding ways to manage it.
Absolutely, 100%, because that emphasis on trying to cure it or stop it can just come with a lot of frustration, and we often find it's not really working and can even make things worse. There are ways to reach for professional help. There are, let's say, online support groups for people affected, but also for children and for parents. And also, there aren't many specialists in terms of accessing therapy, but there are some. So as long as you clarify kind of what the issue is, you should be able to find someone who can work with that.